Allie had a normal pregnancy with her twins until she was 31 weeks and woke up in a state of severe pain and not knowing what was happening to her and her unborn babies.
I woke up one morning, did not have vision. My blood pressure was 180 over 120. It's severe migraine, and we were basically rushed to Sparrow, where I was diagnosed with severe preeclampsia, which is essentially where the placenta starts poisoning the mother's body. You're at high risk for stroke, seizure, heart attack. When the decision was made to deliver 9 weeks early, we obviously were really scared and kind of uncertain of what that would mean.
At that point, the Sparrow NICU doctor walked Allie and Zane step by step through what to expect, which helped calm their fears.
That really helped. I think that was something that was really helpful for us throughout the whole journey with the NICU, and especially being after in the PICU and the PEDS floor, is I feel like you're always guided one step ahead, because it can be so overwhelming and really scary to not know necessarily what the whole journey is going to look like.
The twins were taken right away to the NICU, and Allie was put in critical care. Zane was able to FaceTime her with the babies during the long 5 days until she could meet them in person.
So heartbreaking. It's hard to even put into words the emotional state that you're in. Not only so scared for what is happening to them, but then not being able to be right next to them. It's a very helpless feeling.
Between Briar and Brin, there's multiple medical conditions. Is this something that they're both going to have to deal with for the rest of their lives, or is this something that they could potentially grow out of?
I think a lot of it's outgrowing. The big ones, the hypothyroidism and the murmur, are things we just got to keep an eye on for. Those are the two big ones that I'd say that might stick with them.
The girls were hospitalized again at 3 months with RSV, and that's where they learned that Brin has a severe reactive airway disease that needs special at-home treatments.
Honestly, our doctors and nurses are the type of people who we can call at any point. There's after-hour lines that I call quite frequently, because it is trial and error. You just don't know how to even change a diaper, and that's a very helpless feeling, being the parent and knowing I'm not really sure how to go about this. And they were always so encouraging. It was always step by step. They would only tell us as much as I think we needed to know so that it wasn't overwhelming. But also kind of pushed us when sometimes we were scared to do something, and would teach us, how to handle little babies and babies with medical needs.
The twins have quite a few follow-up appointments, making their lives very busy. Big brother Bennett has adjusted very well. He loves drawing his sister's pictures and showers them with kisses.
Watching your kids go through such difficult situations, but I think there's a lot of comfort in knowing that the resources are there, and they've seen us through some of the hardest, scariest situations of our life, and we're just so grateful because, I just don't know how we would have done it without the nurses, doctors.